Shock. The word shock can describe several different situations. Medical shock happens when the body cells do not get enough oxygen-rich blood. It is not a disease but a result of an illness or injury. A person may also feel shocked when they experience something unexpected. This shock is psychological and usually does not cause any medical problems. Another type of shock is an electric shock, which occurs when a person sustains an injury as a result of exposure to electrical energy. Causes of an electric shock include faulty electrical equipment, lightning strikes, and contact with electricity and water. Although many different problems can cause medical shock, its symptoms are often the same. Medical shock is always an emergency. Without treatment, shock may cause permanent organ damage or death. As many 1 in 5 people in shock will die from it. A severe mismatch between the supply and demand of oxygen is the common feature of all types of shock. Medical facts about shock. Septic shock is a potentially life-threatening condition. Sepsis is a life-threatening bacterial infection that causes a generalized inflammatory response in the body. It affects the immune system and causes it to not respond properly to the infection. The word shock is used differently by the medical community and the general public. The connotation by the public is an intense emotional reaction to a stressful situation or bad news. The medical definition of shock is much different. Medically, shock is defined as a condition where the tissues in the body don't receive enough oxygen and nutrients to allow the cells to function. This ultimately leads to cellular death, progressing to organ failure, and finally, if untreated, whole body failure and death. How the body works. Cells need two things to function: oxygen and glucose. This allows the cells to generate energy and do their specific jobs. Oxygen in the air enters the body through the lungs. Oxygen molecules cross from the air sacs of the lungs into the smallest blood vessels, the capillaries. There they are picked up by red blood cells and attached to hemoglobin molecules. The red blood cells are pushed through the body by the actions of the pumping heart and deliver the oxygen to cells in all the tissues of the body. The hemoglobin then picks up carbon dioxide, the waste product of metabolism, which it is then taken back to the lungs and breathed out into the air. The whole cycle begins again. Glucose is generated in the body from the foods we eat. Glucose travels in the bloodstream and uses an insulin molecule to open the door, where it then enters the cell to provide energy for cellular metabolism. Causes of shock. When things go wrong. If cells are deprived of oxygen, instead of using aerobic, with oxygen, metabolism to function, the cells use the anaerobic, without oxygen, pathway to produce energy. Unfortunately, lactic acid is formed as a byproduct of anaerobic metabolism. This acid changes the acid-base balance in the blood, making it more acidic. This can lead to a situation in which cells begin to leak toxic chemicals into the bloodstream, causing blood vessel walls to become damaged. The anaerobic process ultimately leads to the death of the cell. If enough cells die, organs start to fail, and the body starts to fail and, eventually, death occurs. Think of the cardiovascular system of the body as similar to the oil pump in your car. For efficient functioning, the electrical pump needs to work to pump the oil, there needs to be enough oil, and the oil lines need to be intact. If any of these components fail, oil pressure falls and the engine may be damaged. In the body, if the heart, blood vessels, or bloodstream, circulation, fail, then eventually, death occurs. Where things go wrong. The oxygen delivery system to the body cells can fail in a variety of ways. The amount of oxygen in the air that is inhaled can be decreased. Examples include breathing at high altitude or carbon monoxide poisoning. The lung may be injured and not be able to transfer oxygen to the bloodstream. Examples of causes include pneumonia, an infection of the lung. Congestive heart failure, the lung fills with fluid or pulmonary edema, or trauma with collapse or bruising of the lung, or pulmonary embolism. The heart may not be able to adequately pump the blood to the tissues of the body. Examples of these causes include heart attack, in which muscle tissue is lost and the heart cannot beat as strong and pump blood throughout the body. A rhythm disturbance of the heart occurs when the heart can't beat in a coordinated way. inflammation of the sac around the heart, pericarditis, or inflammation of the heart muscle due to infections, or other causes, in which the effective beating capabilities of the heart are lost. There may not be enough red blood cells in the blood. If there aren't enough red blood cells, anemia, then not enough oxygen can be delivered to the tissues with each heartbeat. Causes. Examples of causes may include acute or chronic bleeding, inability of the bone marrow to make red blood cells, or the increased destruction of red blood cells by the body, an example, sickle cell disease. There may not be enough other fluids in the blood vessels. The bloodstream contains the blood cells, red, white, and platelets, plasma, which is more than 90% water, and many important proteins and chemicals. Loss of body water or dehydration can cause shock. The blood vessels may not be able to maintain enough pressure within their walls to allow blood to be pumped to the rest of the body. Normally, blood vessel walls have tension on them to allow blood to be pumped against gravity to areas above the level of the heart. This tension is under the control of the unconscious central nervous system, balanced between the action of two chemicals, adrenaline, epinephrine, and acetylcholine. If the adrenaline system fails, then the blood vessel walls dilate and blood pools in the parts of the body closest to the ground, lower extremities, and may have a difficult time returning to heart to be pumped around the body. Since one of the steps in the cascade of events causing shock is damage to blood vessel walls, this loss of integrity can cause blood vessels to leak fluid. It leads to dehydration, which initiates a vicious circle of worsening shock. We present a newly developed, clinically oriented classification of the various types of shock and their therapeutic implications. What are the major types of shock? There are 4 major types of shock, each of which can be caused by a number of different events. 1. Obstructive shock occurs when blood can't get where it needs to go. A pulmonary embolism is one condition that may cause an interruption to blood flow. Conditions that can cause a buildup of air or fluid in the chest cavity can also lead to obstructive shock. These include pneumothorax, collapsed lung, hemothorax, blood collects in the space between the chest wall and lung. Cardiac tamponade, blood or fluids fill the space between the sac that surrounds the heart and the heart muscle. 2. Cardiogenic shock. Damage to your heart can decrease the blood flow to your body, leading to cardiogenic shock. Common causes of cardiogenic shock include damage to your heart muscle, irregular heart rhythm, very slow heart rhythm. 3. Distributive shock. Conditions that cause your blood vessels to lose their tone can cause distributive shock. When your blood vessels lose their tone, they can become so open and floppy that not enough blood pressure supplies your organs. Distributive shock can result in symptoms including flushing, low blood pressure, loss of consciousness. There are a number of types of distributive shock, including the following. Anaphylactic shock is a complication of a severe allergic reaction known as anaphylaxis. Allergic reactions. Allergic reactions occur when your body mistakenly treats a harmless substance as harmful. This triggers a dangerous immune response. Anaphylaxis is usually caused by allergic reactions to food, insect venom, medications, or latex. Septic shock is another form of distributive shock. Sepsis, also known as blood poisoning, is a condition caused by infections that lead to bacteria entering your bloodstream. Septic shock occurs when bacteria and their toxins cause serious damage to tissues or organs in your body. Neurogenic shock is caused by damage to the central nervous system, usually a spinal cord injury. This causes blood vessels to dilate, and the skin may feel warm and flushed. The heart rate slows, and blood pressure drops very low. Drug toxicities and brain injuries can also lead to distributive shock. 4. Hypovolemic shock. Hypovolemic shock happens when there isn't enough blood in your blood vessels to carry oxygen to your organs. This can be caused by severe blood loss, for example, from injuries. Your blood delivers oxygen and vital nutrients to your organs. If you lose too much blood, your organs can't function properly. Serious dehydration can also cause this type of shock. What are the signs and symptoms of shock? If you go into shock, you may experience one or more of the following. Rapid, weak or absent pulse, irregular heartbeat, rapid, shallow breathing, lightheadedness, cool, clammy skin, dilated pupils, lackluster eyes, chest pain, nausea, confusion, anxiety, decrease in urine, thirst and dry mouth, low blood sugar, loss of consciousness. What causes shock to occur? Anything that affects the flow of blood through your body can cause shock. Some causes of shock include severe allergic reaction, significant blood loss, heart failure, blood infections, dehydration, poisoning, burns. Shock diagnosis. The approach to the patient in shock requires that treatment occur at the same time as the diagnosis occurs. The source of the underlying disease needs to be found. Sometimes it is obvious, for example, a trauma victim bleeding from a wound. Other times, the diagnosis is elusive. The type of tests will depend upon the underlying condition. The diagnosis is most often found through the medical history. A thorough physical examination will be undertaken and the patient's vital signs monitored. Vital signs. Patient vital signs monitored might include continual blood pressure and heart rate monitoring, and oxygen measurement. Special catheters may be inserted into the large veins in the neck, chest, arm, or groin. They are threaded near the heart or into the pulmonary artery, to measure pressures close to the heart, which may be a better indicator of the body's fluid status. Other catheters may be inserted into arteries, arterial lines, to measure blood pressures more directly. Tubes may be placed in the bladder, Foley catheter, to measure urine output. Blood laboratory tests will be performed, the type dependent on the underlying disease or condition. Radiologic tests may be performed dependent on the underlying illness. What is the treatment for shock? Depending on the type or the cause of the shock, treatments differ. Fluid resuscitation, giving a large amount of fluid to raise blood pressure quickly, with an IV in the ambulance or emergency room, is the first-line treatment for all types of shock. The doctor will also administer medications such as epinephrine, norepinephrine, or dopamine to the fluids. It is to try to raise a patient's blood pressure to ensure blood flow to the vital organs. Tests, for example, X-rays, blood tests, EKGs, will determine the underlying cause of the shock and uncover the severity of the patient's illness. Medical treatment. Septic shock is treated with prompt administration of antibiotics depending on the source and type of underlying infection. These patients are often dehydrated and require large amounts of fluids to increase and maintain blood pressure. Anaphylactic shock is treated with diphenhydramine, epinephrine, steroid medications, methylprednisolone, and sometimes H2 blocker medication, for example, famotidine, cimetidine, etc. Cardiogenic shock is treated by identifying and treating the underlying cause. A patient with a heart attack may require a surgical procedure called a cardiac catheterization to unblock an artery. A patient with congestive heart failure may need medications to support and increase the force of the heart's beat. In severe or prolonged cases, a heart transplant may be the only treatment. Hypovolemic shock is treated with fluids, saline, in minor cases, but may require multiple blood transfusions in severe cases. The underlying cause of the bleeding must also be identified and corrected. Neurogenic shock is the most difficult to treat. Damage to the spinal cord is often irreversible and causes problems with the natural regulatory functions of the body. Besides fluids and monitoring, immobilization, keeping the spine from moving, anti-inflammatory medicines such as steroids, and sometimes surgery are the main parts of treatment. Self-care at home. Call 911 for immediate medical attention anytime a person has symptoms of shock. Do not wait for symptoms to worsen before calling for help. Ambulance. Stay with a person until help arrives, and if possible, stay on the line with the 911 dispatcher because they may have specific instructions for you. While waiting for help or on the way to the emergency room, check the person's airway, breathing and circulation, the ABCs. Administer CPR if you are trained. If the person is breathing on his or her own, continue to check breathing every 2 minutes until help arrives. Do not move a person who has a known or suspected spinal injury, unless they are in imminent danger of further injury. Have the person lie down on his or her back with the feet elevated above the head. If raising the legs causes pain or injury, keep the person flat to increase blood flow to vital organs. Do not raise the head. Keep the person warm and comfortable. Loosen tight clothing and cover them with a blanket. Do not give fluids by mouth, even if the person complains of thirst. There is a choking risk in the event of sudden loss of consciousness. Give appropriate first aid for any injuries. Direct pressure should be applied to any wounds that are bleeding significantly. What is the outlook for shock? Prompt treatment of medical shock is essential for the best outcome. Moreover, the outlook depends on the cause of the shock, the general health of the patient, and the promptness of treatment and recovery. Generally, hypovolemic shock and anaphylactic shock respond well to medical treatment if initiated early. Septic shock is a serious condition with a mortality rate of 24% to 50% according to some estimates. The sooner the infection is treated and fluids are administered, the greater the chances of success. Hospitals are now developing and utilizing specific protocols to identify and aggressively treat septic shock patients. Cardiogenic shock has a poor prognosis, with only 1/3 of patients surviving. Because this type of shock results from injury or dysfunction of the heart, it is often difficult to treat and overcome. Spinal shock also has a very poor prognosis because the spinal cord mediates so many important bodily functions. There are currently very few effective treatments, but medical research is making advances in the treatment of spinal injuries.